fingers. Hi, Katie.
Hi.
I'm Dr. Matt. I'm going to do your exam today. Thanks for coming in. Let's go ahead and verify your chart. I want to make sure that I have all the right information.
Okay.
Can you please verify your date of birth?
March 23rd, 1988.
Okay, do you have any allergies?
No. Just a pollen.
Okay.
Yeah.
Are you taking any medications on a daily basis?
No.
Okay, and you're here for a head-to-toe exam.
Yes.
When was the last physical that you had?
It was a year and a half ago, yeah.
Okay. Okay, I'm going to ask you a few questions about your medical history. Are you experiencing any joint pain?
No.
Okay. Have you had any surgeries in your lifetime?
Yes, I've had two. I've had a bunionectomy and RCPD surgery, and they both went really well.
Perfect. And when were they?
The bunionectomy was 2013, and the RCPD was this August.
Okay. And no complications, you said? Alright. Any injuries that I should be aware of?
No, I've been having some leg pain lately, and I'm not sure if that's due to an injury while running or not, but just around my knee.
Leg pain. Okay.
Yeah.
And for how long has that been going on?
About a month. Yeah.
Is it in both legs?
No, it's mostly my right leg.
Right leg. And how would you describe the pain?
It's like a soreness that sometimes gets so intense, especially at night, that it feels like sharp pain.
Okay. Do you feel any tingling sensations?
Not that I've noticed, no.
Okay. Are you experiencing any cramping?
No.
Okay, so you say mostly it feels like soreness. And you also jog?
Yes.
How often?
I run for 40 minutes. I try to every other day, sometimes less during the cold months.
Okay, for how long have you been doing this regimen?
I do it every summer, consistently all summer, and then I slow down in the wintertime. So for about 10 years. Yeah.
Okay. So that's a good indication that maybe running isn't what is causing the soreness.
I don't think so, because it's not equal. I mean, it could be, but that's not my instinct.
And have you noticed your reflexes being a little bit slower?
A little bit, yeah.
Okay. Any difficulty blinking or swallowing food?
No.
Okay. Any other pain, muscular, that you would describe in your back or?
My back gets tense from time to time, but I know it's from just anxiety issues. Like there's no sharp pain or injury related. It gets tense.
Okay. Have you noticed any changes with your vision?
No.
And you wear contacts, correct? Okay. What about your hearing? Do you hear any buzzing or sounds that may not be here?
Some tinnitus every once in a while, like a ringing, but it hasn't changed for the last like 15 years, just from time to time.
Okay, so it's chronic.
Yeah.
And that's only in your right ear?
Both ears.
Both. Okay. Was it diagnosed by a physician?
No, I just
realized
heard
it.
And I looked it up and just talked to friends, and I think it's tinnitus.
Okay. And did you take any medications that might have caused it?
Not to my knowledge, no.
No injuries to the head?
No.
Okay. Okay, so I'm going to start this exam with vital signs, and I'll listen to your heart and your lungs to make sure that everything is healthy.
Okay.
Okay, I'm just going to put gloves on. Have you noticed any flu-like symptoms in the last 48 hours?
No.
Do you experience any pins and needles anywhere in the body?
No, just like when my foot falls asleep if I've been sitting on it weird, but nothing outside of that.
Okay. So I'm going to take your temperature first. This will go under your tongue. I'm going to have you hold it for me. Thank you. And we'll measure your oxygenation as well and your heart rate. Okay, let's go ahead and check this. 98.1, that's perfect. And 96 percentile room air, that's good, and heart rate is 60. Okay. Is it okay if I use this arm? Okay. So I'm going to match the artery. Perfect. We're using the right cuff for this. This is going to feel a little bit cold. Go ahead and uncross your legs and relax. Blood pressure is 98/60. That's normal. Okay. So I'm going to start with a gentle scalp and face palpation. Alright, so go ahead and relax. Okay, I'm going to apply pressure on both sides of the head at the same time. Go ahead and tell me if you feel pain.
No.
Okay.
No.
Okay, I'm going to check your scalp. Scalp is very clean. Looks like there's no redness and even distribution of the hair follicles. I'm not noticing any signs of alopecia. No signs of dehydration. The hair looks very healthy and even distribution. Okay, so let's go ahead and check your vision. I'm going to ask you to look straight at my nose. I'm going to flash a light in your eyes. We're going to check pupil dilation and constriction. Very good. Okay, go ahead and follow the light with your eyes only. Don't move your head. Okay, now go ahead and look right here for me. Now look here. Okay. Going to check inside your mouth. So I'm going to look at the tonsils. Okay. Not noticing any redness. Go ahead and say ah. Alright, are you experiencing any throat pain?
No.
Okay, let's go ahead and check your sinuses. So I'm going to palpate right here in between your eyebrows.
Okay.
And right under your eyes. I'm not feeling any swelling. Okay. Go ahead and smile for me. And frown with your eyebrows. Good. Puff your cheeks. Keep them puffed for me. Don't let me unpuff them. So try again. Don't let me unpuff them. Okay, good. Very good. Go ahead and relax. I'm going to put my hands on your shoulders. Go ahead and shrug them. Okay. And I'm going to try to push your head to the right. Don't let me do that. Okay. Alright. I'm going to palpate your mastoid bone now. Looking for any signs of mastoiditis. And any pain when I pull up on the...
No.
Okay, go ahead and close your eyes. Go ahead and tell me with which ear you hear the sound.
Left. Right. both.
Okay. Going to take a look inside your ears. Right. Tympanic membrane is per gray. I'm not seeing any redness or pus. The canal is relatively clean and very good. It looks like you're not inserting the Q-tip inside. That's
No,
good.
yeah.
Okay. Right here has clean tract. Tympanic membrane is well marginalized. No fluid buildup behind it. No redness. No signs of infection. And the hearing seems to be normal. Let's go ahead and check with a tuning fork.
Okay.
Go ahead and tell me when you don't hear this sound anymore.
No. No.
Now tell me which position here is louder, position 1 or 2. 1, 2.
2.
1 or 2.
2.
Okay, that's good. Alright, so I'm gonna have you change into this gown, and when I come back, I'll do a full body exam as well.
Okay. Thank you.
I'm going to palpate your lymph nodes. We're looking for anything that is swollen. So we have here submental lymph nodes, followed by cervical and preauricular. And postauricular lymph nodes, which are a little bit down the neck, behind the ear. Moving down the neckline. Right above the clavicles. Okay. And cervical occipital lymph nodes, which are a little bit behind the neckline. Okay. I'm going to listen to your heart. Is it okay if I open the gown? Yes. Okay. So I'm gonna have you breathe normal. can hear only S1 and S2, no S3, no S4. We're going to check for murmurs with the bell. For this, I'm going to ask you to take a deep breath and hold it for 3 seconds. 1, 2, 3. Breathe out. Very good. And now go ahead and breathe in and exhale. Good. Breathe in and exhale. Okay. I'm going to listen to the jugular as well. So we're looking for aortic stenosis or bruit. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Now I'm going to compare with the other side. Go ahead and take a deep breath in and hold it for 1, 2, 3. Breathe out. Very good. Okay. Going to check your facial reflexes. So go ahead and relax. You're just going to feel a gentle tap. Relax your jaw. So we're just tapping on the bony prominences. Okay. Going to check your scalp sensitivity. Okay, now we're taking a better look at the scalp. We're looking for swelling and any fluid that is building up. I'm going to do a few tests here. Go ahead and tell me if this feels cold or warm for you.
Cold. Warm. Cold. Warm. 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 Cold.
Okay, now I'm going to touch you with 2 textures. One is going to feel sharp and the other one is going to be dull. This is what sharp is going to feel like. And this is what dull is going to feel like. Go ahead and confirm if you felt those.
I could barely feel the dull one.
Okay. So let's go ahead and try and see how this does. Go ahead and tell me if you feel sharp or dull.
Sharp. Sharp. Dull. Dull. Sharp. 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 Dull. Sharp. Sharp.
Okay.
Sharp. Dull. Dull.
Okay. Very good. I'm going to start with the lower body now and examine your abdomen as well. Is it okay if I open the gown? Okay, so I'm going to take a look at your abdomen. We're looking for any redness. Okay, first I'm going to visualize. I'm noticing a little bit of swelling that just want to make sure it's not related to any organ. I'm not noticing any redness. So first I will listen for any normal sounds. It's gonna feel a little bit cold. Normal activity is heard on all four quadrants. I'm listening to the aorta for any buoy. Going to palpate, starting with liver. We want to make sure that margins are right under the rib cage. Also, I'm not noticing any swelling. Okay, let's go ahead and take a few measurements. We're looking for inflammation that would be triggered by asymmetry. Okay. Go ahead and tell me if you feel this on the left or right.
Left. Right. Right. Left. Left. Right. Both.
Go ahead and tell me if you feel this 2 or 1 pressure point.
2, 2, 1, 1, 2, 1, 1, 2, 1, 1, 1, 2, 1, 2.
Okay. Go ahead and take a look at your back. I'm going to take a look at your skin on the back. I'm noticing that you do have more than maybe 50 moles, so you need to take extra precaution with sun exposure and to minimize toxins. Looking at the back and musculature to see if there is anything swollen. Could you take a few measurements? We're checking for asymmetry and inflammation around the spine. You did notice that you were having a little bit of tense muscles due to anxiety. I just want to make sure that physiologically everything is normal, that there's no fluid buildup. Okay, first I'm going to listen to your lungs. Go ahead and take a deep breath in and exhale. We're looking for any abnormal sounds. Again, breathe in and breathe out. Breathe in, breathe out. And again, breathe in and breathe out. And again, breathe in, exhale. Breathe in, exhale. Breathe in, exhale. Okay, then go ahead and breathe normal. You can breathe normal. Going to do a skin perfusion test. A little bit more flexibility on the right side. I'm going to test your dermatomes. Go ahead and tell me if you feel this cold or warm.
Cold. Warm. Warm. Cold. 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 Warm. 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 Cold.
And I'm going to touch you with two textures. One is going to be sharp and the other one is going to be dull.
Sharp. Dull. Dull. Sharp. Dull. 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 Sharp. sharp, sharp, dull, dull, sharp, sharp, sharp.
Okay. Looks very good. I'm going to check your legs now and your feet. Okay, Katie. I'm noticing a little bit of bruising around the second toe. And I know you mentioned that you jog a lot, so maybe we can recommend switching shoes and finding a better support for your feet.
Yeah.
Okay. Let me know if you feel any kind of pain. So I'm expecting that you'll feel a lot of soreness like you described.
Yeah, a little bit there.
Okay. We might experience a little bit of maybe a fissure of one of those bones that connect together. And the only way to tell if that's the case is to do an x-ray and check for any bone fracture. Just going to take a look in between the toes to see if there is any cracking of the skin. You mentioned your right leg was the one that was causing you a little bit of extra soreness. Go ahead and wiggle your toes for me. Okay, that's symmetric. And close your eyes. Tell me on which foot you feel this. Okay, and this. And this. And this. Good. Going to check your reflexes. Good. You did mention that your reflexes were also diminished, so I would say bilateral too. Going to check your pulses. 2+, strong. Okay. Capillary refill is within 2 seconds. It's very normal. Go ahead and tell me towards which way I'm moving your toe, towards you or towards me.
Towards me. Towards you.
Okay.
Towards you. Towards me.
Okay, very good. I'm going to check your Babinski reflex. Okay. Okay. Perfect. Go ahead and wrap your toes around my fingers. Very good. I'm gonna try to push the feet towards me. Don't let me do that. Okay. I'm gonna try to push them now towards you. Don't let me do that. Very good. I'm gonna try to open them. Don't let me do that. And close. Okay. Very good. So go ahead and turn on your belly. I'm going to take a look at your calves and see if there's anything that we can do there.
Okay.
Okay, so just pressing right behind the knee capsule to see if there is any swelling. Going to check for asymmetry. Okay, I'm going to try to push down on your right leg, and in the same time, go ahead and try to lift it up, okay? Go ahead and try and lift it up. And resist. Good. We'll do the same thing on the other side. And resist. Good. Okay, so bilateral strength, I would say 3. We're going to go ahead and do a lymphatic massage. This is an anti-inflammatory oil that helps with lowering fluid buildup. It increases circulation in the area, so the soreness is definitely going to decrease. We're just slowing, moving up the lymph so that we can equilibrate the system. This is going to feel a little bit cold. And we're applying cryotherapy to the muscles, cells to lower inflammation in the body. Using a little bit of manual therapy to increase circulation. I'm going to go ahead and just take a look at your chart. So we did a very detailed full body exam. I did notice a little bit of swelling in the back, so I do want to do more testing to make sure that it's just muscular. And then we did do a lymphatic massage that will help with the soreness you're experiencing in the legs. Okay, and I would like to see you back again in about 2 weeks. We can definitely do another lymphatic massage and see how the soreness feels. I don't want you to take it slower unless it really bothers you, the pain. Because I want your body to get used to running and being active. But we definitely don't want you to be in any pain so that, it's not any discomfort. So if you need to come in sooner, just go ahead and give us a call.
I will, and it felt really, really good. So thank you for the treatment in addition to the exam.
You're welcome.
All right.
Very nice to see you. I'm going to start this session with singing bowl. Allowing for the vibrations to enter the healing state. I'm going to begin the session. I read in your file that you're having a little bit of pain and muscle spasms. So let's go ahead and check. First, we're going to start with scapulas. I'm going to slowly start palpating and see if there is any fibrous tissue surrounding it. So we're mainly looking at mobility. There's definitely less movement on the left side. I'm going to do a hydration to chest. There's very little redness, so I'm not worried about any mineral deficiency. I'm going to start by palpating your cervical spine. Looking for swelling, increased pulsations, or muscle tension. T1 and T2. T4 and T5. Very little mobility on this side, so we can definitely work on increasing the space in between them. And mainly just letting them move a little bit more freely. That will help with decreasing pain level. Okay, I'm going to do a test to see exactly the movement that we're having here. So I would say this is about T6. It's 33%. It should be anywhere between 50 and 65. There's definitely lower movement here. Decrease circulation on the left side. Going to check neurological status. Okay. Go ahead and tell me how many times you feel this tap. 1, 2, or 3.
2, 1, 3, 1, 2, 3, 1.
Okay. And do you feel this on the left or right?
Right, left, middle, left, right, right, left, middle.
Go ahead and tell me if you feel this equally on both sides.
Yes, yes. More on the left, more on the left.
Okay. Now go ahead and tell me if you feel this sharp or dull.
Dull, sharp, sharp, dull, sharp, dull, dull, sharp, sharp, dull, 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 sharp, dull, dull. Go ahead and tell me how many times you feel this tap. 1, 2, or 3. 2, 1, 3, 1, 3, 2, 3, 1.
Okay. I'm going to go ahead and tap along the spine. I'm looking for any vibration changes. Now go ahead and tell me if you feel this on the left or right.
Right, left, right, 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 left, 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 left.
Okay. Go ahead and tell me if you feel this sharp or dull. Do you feel this sharp all the way?
No, I only feel sharp on the top of my back.
Okay. What about on the left side? Does it feel sharp all the way?
Yes.
Okay. Go ahead and tell me if you feel this 2 or 1 pressure point.
One. 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 Two. Two. One. 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 Two. Two. One. Two. One. 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 Two. Two. One. Two. One. One. Two.
Okay. Okay, to take a few measurements. I'm looking for asymmetry in the spine, and then we're going to check for any scoliosis, lordosis, or abnormal curvatures. That could definitely trigger pain and tension in the paraspinal muscles. Slight shift in angles, so I'm worried that there is a beginning of scoliosis. I'm going to take a few measurements for the scapula as well. slight deviation of the spine towards the right side. Just going to brush the skin. We're looking for abnormal skin lesions that are raised from the surface. I'm not noticing any skin lesions. That would be concerning, but I do want to take a few samples and send them to the lab. The solution allows for the tissue to be defragmented and just very gentle exfoliating without damaging the skin. Okay, we're going to send this to the lab and we'll do a very thorough examination. And now what I'm going to like to do is to start with a sensory brush and allow for the nerves to desensitize. to apply acupressure therapy in the zone that has more inflammation. This helps to activate the main sensors and send signals that the tissue needs to be repaired. Going to apply anti-inflammatory oils so that we allow for the tissue to heal faster. We're going to start performing fire cupping therapy. fire cupping. It's very helpful to increase circulation in certain areas. And we're focusing mainly on the paraspinal muscles that we want to stimulate blood flow and really help them increase circulation. Okay, we're going to allow for the toxins to be absorbed through the surface. I'm going to go ahead and remove them. Working on reducing swelling. applying gentle cupping therapy that helps mainly with lymphatic drainage and reducing toxins that are very close to the surface of the skin. Multiple pressure points. It also helps to stimulate blood flow. Okay, we're going to use a tense unit to stimulate movement in the thoracic area. And I'm going to start with a minimum strength. And we're going to leave it for about 10 minutes. Okay. Go ahead and let me know when you start feeling it, okay?
I do.
You do? Okay. Let me know when you start to feel kind of like a sharp sensation.
I do.
Okay. So I think we are at about 40% capacity. We're just going to leave it like this. And we're going to continue treatment. Going to stimulate blood flow in the lymphatic system that is around the thoracic and cervical area. It helps to reduce swelling. go ahead and turn off the TENS unit. And we're going to place them back. Going to perform some skin pulling therapy. This will help to increase the space between the skin layers and allow for the nutrients to go a lot easier towards the muscle fibers. Alright, very good, Katie. You're ending today's session. I'm going to allow you to wake up on your own time. Hi, Katie.
Hi.
It's very nice to meet you again. My name is Dr. Matt. I'm going to do your exam.
Great.
So, before we begin, I'm going to take your medical history. And then I will ask you a few more questions to see exactly what your goal is for today. After that, we'll start the exam.
Okay, sounds good.
Can you please verify your first and last name and your date of birth?
Katie ASMR, March 23rd, 1988.
Do you have any allergies?
No.
Okay, when was your last checkup?
It was a year ago, so it's been a while.
Do you take any medications?
No, not currently.
Any surgeries?
No.
Do you have any medical history?
I took antidepressants for a while. I had a bunionectomy 10 years ago. Was in the hospital with pneumonia when I was a child.
Okay. And how many hours per night do you usually sleep?
6 to 8, depending.
Okay. Do you follow a special diet?
No.
Are you experiencing any pain right now?
No, not really.
Okay. Do you have any difficulty breathing sometimes? Feel any palpitations?
No, not really. I do have abdominal bloating sometimes.
Okay. And have you noticed that it comes and goes, or is that all the time?
It's been pretty constant lately.
And you said you have no allergy, so you don't know if you're allergic to any foods yet, right? Or if you're sensitive.
I did take an allergy test a while ago, and it said I was allergic to every food on the list, so I think it might have been
That you were allergic?
yeah, but I think it probably was a faulty test because
Okay.
I eat all the foods on the list, so.
Okay. So maybe we can repeat one of those tests that we have in the office.
Okay.
All right. Do you suffer from frequent headaches?
No.
Okay. All right, I'm gonna go ahead and take your vital signs.
Okay.
So this will go on your index finger. We're going to measure your oxygenation and heart rate. Really relax. And then I will take your temperature. 98.3. Okay. Oxygenation is 95% on the room air. And heart rate seems stable in the 70s, which is perfectly normal. Let's go on and take your blood pressure. Okay, go ahead and relax your arm. And uncross your legs for me, please. Perfect. And I'll have you relax, breathing normal. Blood pressure is normal, 110/65.
That's good.
I'm going to listen to your heart and lungs.
Okay.
I'm gonna have you breathe normal as well. I can hear only S1 and S2, no S3, no S4. Let's take a listen with the bell in here for any murmurs. Can you take a deep breath in and hold it for 3 seconds? Breathe in, hold it in, and breathe out. Let's do one more time. Breathe in and hold it for 1, 2, 3. Breathe out. Okay. Very good. Now take a deep breath in and exhale. And take a deep breath in and exhale. One more time. Breathe in, exhale. Alright, I'm going to have you turn around so I can listen to your back, okay?
Okay.
Take a deep breath in and exhale. One more time. Breathe in and breathe out. Very good. Breathe in and breathe out. Breathe in, breathe out. And again. Exhale. Inhale, exhale. Good. One more time. Okay. I'm going to have you stay there. So we're going to tap. We're looking for any fluid buildup or signs of pneumonia. Have you been experiencing any recent cough?
Yes, actually.
Okay. Alright, so everything looks good. Now I'm gonna have you turn around. We'll do a few more tests before I have you lay down and relax on the table, okay?
Okay, sounds good.
Alright, I'm going to put gloves on. Since you mentioned that you're having a little bit of cough, I want to take a look inside your throat and see if there is any infection or signs of inflammation.
Okay.
Okay, go ahead and give me a big I'm noticing a little bit of redness on both sides. Uvula is midline. Tongue is pink, well moistured and symmetric. Go ahead and try to push with your tongue inside your cheek. Good. And on the other side. Excellent. Can you give me a big smile and frown with your eyebrows? Good. Can you puff your cheeks for me? Keep them puffed. Don't let me unpuff them. So let's do that one more time. Don't let me puff them. Okay, perfect. And can you move your tongue up and down, side to side? Perfect. So that was good synchronization there. Just going to check the patency of your nose now. And just going to slowly palpate to see if there is any signs of deviated septum or anything like that. Okay. Can you go ahead and breathe in, breathe out? One more time. All right, perfect. Going to go ahead and check your sense of smell first. I'm going to have you close your eyes and just slowly and normally breathe in through your nose, okay? What does that smell like?
It smells like cedar.
So let's go ahead and try one more. Close your eyes. That usually heightens the sense of smell. Breathe in, slowly concentrate on the smell that your brain is percepting. And what does that smell like to you?
Vanilla.
Alright. And we're going to go ahead and check your taste as well. So the same thing we're going to do now. I'm going to have you close your eyes so that we allow your brain to focus only on the taste. Perfect. Go ahead and tell me what that tastes like.
Tastes bitter.
Bitter?
Mm-hmm.
Okay. Let's try this one now.
Sweet.
Sweet. Perfect. Okay, so I'm going to check your pupils now. Go ahead and look straight at my nose. Good. Keep on looking straight at my nose. Perfect. I'm going to lower your eyelid. Take a look and see if there is any yellowish discoloration. Good. Good. And now go ahead and look right here. I'm not noticing any rhythmic movement. Now look here. Okay, very good. Go ahead and follow my finger with your eyes only. Don't move your head. Okay, very good. Go ahead and cover one eye now. And I have here a Snellen chart. Go ahead and grasp the Snellen chart with your other hand and extend your arm all the way. Perfect. How does that look for you?
Pretty clear. Yeah.
Okay. Go ahead and read this last row, starting with the first letter to the left.
HPFTL.
Okay. And what color do you see here?
Green.
And here.
Red. Orange.
And what number do you see here?
8.
What about here?
2.
Which circle is smaller, 2 or 3?
2.
Okay. Let's go ahead and switch eyes now.
Okay. Go.
Okay. Extend your arm all the way. Perfect. And go ahead and read this row, starting with the first letter to the left.
LTFPH.
And what color do you see here?
Green.
And here.
Red.
What number do you see here?
8.
And here.
6.
And which circle is larger, 6 or 7?
7.
Okay, perfect. All right. So now what I'm going to have you do is I'll have you laid down and I'll give you a count to change. We'll do a back and abdominal assessment and we'll see how everything looks, okay?
Sounds good.
I'm going to first palpate your scalp. And let me know if you feel any kind of pain. Okay. Head is symmetric. I'm not feeling any lumps. Normocephalic. Okay, perfect. I'm going to take a look at the scalp to see if there is any infection. I'm not noticing any redness. I'm going to do a few tests. First, I'm going to lower the acidity of the scalp. That will help to assess if there is any infection of the follicle. I'm going to apply a drop of the solution at the base of the follicle. And we're going to make sure that we distribute it evenly. Okay. Now go ahead and tell me if you feel this on the left or right.
Right. left, left, right, left.
Go ahead and tell me if you feel this soft or sharp.
Sharp, sharp, soft, sharp, sharp.
Scalp looks in very good health. Not noticing any vesicles, papules, raised bumps. There's no redness, no sun damage. Okay, now go ahead and tell me if you feel this on the left or right of the hair part.
Left, right, left, right, right, left, 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 right. Okay, in the middle.
Oh, perfect. Everything looks very good. Now I'm going to go ahead and check your abdomen. Okay, Katie, go ahead and make yourself comfortable. If you experience any kind of pain, let me know. So first, just going to visually inspect for any redness, any swelling, asymmetry, which could indicate a little bit of inflammation. So I'm going to go ahead and just listen with the bell first. It's gonna feel a little bit cold. I'm noticing a little bit of decreased sounds around the middle, very close to the umbilicus. And then besides a little bit of bloating, are you experiencing any other symptoms?
Not really.
So I want to make sure that I'm listening on all four quadrants. Percussion exam is normal. I'm going to go ahead and slowly palpate. seems to me that there is a little bit of inflammation around the belly button, the umbilicus area. So I want to take some measurements. That way we know for sure how much asymmetry we have. About 4 to 5% difference. Okay. Looking for any pulsations or changes in skin. Go ahead and tell me if you feel this on the left or right.
Left. Right. Center. Center. Both. Left. Right. Right. Left. Left. Right. Right.
Okay, very good. The treatment that I'm recommending, it's an anti-inflammatory ointment. And it's going to be applied 3 times a day
Okay.
around the central region of the umbilicus. Okay. Slowly I'm going to distribute it. Okay, I'm going to go ahead and check your legs and reflexes. I'm going to go ahead and just lift the blanket. Okay, I'm going to check pedal pulses. Make sure that they are both strong and synchronizing. Very good. I'm going to check for any edema. Good. Temperature on both feet seems to be about the same. Can you go ahead and wiggle your toes for me? Very good. Now go ahead and try to pull your toes towards you, and I'm going to push in the opposite direction. Go ahead, pull, pull, pull. What about the right one? Seems to be a tiny bit weaker. Okay, good. Relax. Now go ahead and push with the pads. Relax. And try to wrap your toes around my fingers. Good. I'm going to move your toe either towards you or towards me. Go ahead and tell me which way it's going, okay?
Okay. Towards me. Away. Towards me. Away.
Okay, very good. Do you feel this on the left or right?
Left. Right. Left. Right.
Okay, I'm going to check your Babinski reflex. Go ahead and relax. Good. Perfect. I don't hear any abnormal sounds on the left. Okay, very good. Now let's go ahead and check your spine alignment. Okay, I'm going to start with measurements. No deviation of the spine. Not noticing any scoliosis or lordosis. I would say that your back is very symmetric, so I have no concerns about the alignment of the spine. I'm going to check the skin though. Since you do have a few moles, we want to make sure that they look good and that they're healthy. So now I'm just checking a few of the moles to see if we notice any changes after we apply a solution. And mostly I'm focusing on the ones that have a little bit of an abnormal shape or just seem to be slightly larger. deep breath in and exhale. And again, breathe in, breathe out. Breathe in, breathe out. And again. I'm not noticing any signs of pneumonia. I'm going to have you stand up and we're going to discuss the results and see what recommendations we have for you today. Alright. Everything looks very healthy.
Good.
Next, I'm going to send you to the Women's Health Department, and that's where we're going to do a gynecology exam and a pap smear since it's been about 3 years since you've had one.
Okay.
And then we're also going to do some blood work. Is that okay?
Yes, yes.
Okay. Okay, no medicine for today that I need to prescribe. Do you have any questions for me?
Not right now. Thanks.
Okay, wonderful. Thank you, Katie, for coming in.
Yes.
And I'll see you soon.
All right.
Hi, Katie.
Hi.
My name is Dr. Matt. I'm going to do your exam today.
Okay.
Let's go ahead and verify your first and last name and your date of birth.
It's Katie ASMR, March 20th, 1988.
Okay. And do you have any allergies?
No, not that I'm aware of.
Okay. So go ahead and tell me a little bit about what's happening today.
I've been having some really weird back pain, and it kind of starts in the middle of my back. The weird thing about it is that it radiates up almost to the bottom of my scalp.
Okay.
And so I'm having some scalp pain that's really hard to discern. It's a little numb. It's just very sore.
Okay. On a scale of 0 to 10, how would you rate your pain?
About an 8.
Okay. And are you feeling any tingling sensations around the back?
Sometimes the tingling is more on my scalp, but sometimes it goes down to my back. Like I said, it's kind of hard to tell what's going on where.
And how long ago did it start?
It started like a month and a half ago, and then just got really progressively worse.
Any family history of neurological disorders?
Not that I'm aware of. No.
Okay. Any muscular degenerative disorders?
No.
Okay, so no family history. And are you taking any medication that could cause some numbness or nerve pain?
I've just been taking supplements, and then I take trazodone at night to sleep, but that's been the same for years, so yeah.
Okay. Any spine injuries that I should be aware of?
No, I'm a runner, so from my experience, that has really impacted my back a lot before this.
Okay. How often do you run?
I run 3 times a week. I go from anywhere from 30 to 40 minutes at a time.
Okay, when was the last time you changed your shoes?
Oh, it's been around almost a year.
Okay. So, not a lot of people know, but shoes do have an expiration date, especially it matters like how much they're being used, of course. It's not about time necessarily, but from what you're telling me that you're running, I would say it's about 6 to 8 months that they could last you, and after that, they do not give the same support, and that could definitely do some damage on the spine and the way you walk and how the balance is.
Okay, that's good to know. Yeah, they're my only pair, so I walk in, I run in them.
Okay. We can definitely take a look at your shoes too to see if you need a new pair and how they're helping with your gait. But I do want to take a look at your back and scalp to see if I'm noticing any neurological disorders, something that could be triggered by nerve damage, or if it's muscular. Okay, I have everything I need. I'm going to have you change and then I'll take a look at your scalp.
Okay.
Okay, I'm going to take a look at the scalp. The scalp is also connected to everything that's happening neurologically, and I want to make sure that both hemispheres are connected properly. I'm noticing a little bit of redness at the base of the scalp. I'm going to apply a grapefruit essential oil. I want to relax the muscles before I examine them. Okay, we're going to test for any vibration deficit. I'm going to place this right around the cervical spine. C1. Can you please tell me when you don't feel this anymore? Okay. We're just moving up the scalp. Go ahead and tell me when you don't feel it anymore. Can you please tell me if you feel this equally on both sides?
Well, I feel more on my right than my left.
More on the right. Okay. definitely some redness behind the ear. Go ahead and turn your head this way. Okay, I want to see if there's any redness behind the ear. Now relax your head. Let's check the other side. Any pain as I'm palpating here?
No, just a little soreness.
Okay, smell some mustard bone. It's connecting the other parts of the skull with the facial bone and the tympanic membrane. I'm not noticing any scalp disorders. Just a little bit of swelling. Okay, I'm going to apply an anti-inflammatory oil. Okay, this is going to feel a little bit cold. I'm going to massage your scalp. I want to make sure that this oil really penetrates the skin. This helps to stimulate the muscle cells.
That's really good.
It also increases circulation, and it helps for the serum to be more easily absorbed. Okay, I'm going to do hair pulling. This technique really helps to increase circulation in certain areas that we're targeting. Okay, I'm going to go on and take a look at your spine now. Okay, Katie, I'm going to first put your hair up so that we can take a look at your upper spine. going to start by palpating your C1 and C2. There are some points here that, if they're too inflamed, they can cause a lot of discomfort in the sacral and lumbar region, which is definitely where you are experiencing the most discomfort at the moment. Just slowly going to palpate the occipital lobes as well. There's very little space between C1 and C2, so I would like the axis to be a little bit more mobile than this. Moving down to C3, there's a tiny bit of a shift on the axis, which could indicate immobility. And there's a constriction here. Do you feel that?
Yeah, a little tender.
Okay. That's sort of a point that can be caused by a constriction of vessels coming in and out through the orifices of the vertebrae. Just slowly sliding down my fingers here, looking at the curvature. I would like to see this a little bit more curved. A little bit of redness, also some swelling in the thoracic area. Pulsation moves. We are definitely dealing with a spine abnormal movement. And you see how here you can see a little bit more indentation. And as you move up, it's flatter and flatter. I would like to be a little bit more space on each side of the vertebrae, on the spine. Okay. Any pain as I'm pressing down here?
No, it's more in my mid and upper back.
Okay. Just trying to see if there's any microscopic movement that can be heard with the stethoscope. take a few measurements, especially in the thoracic area where you're experiencing more pain. This is the space that we would like to be a little bit larger, and I'm going to look for inflammation and asymmetry. It's going to feel kind of like a squeezing sensation. It's exactly 1. Zero 0.9, so plus 0.8. Again, less 0.7. One. That's good muscle there. It's definitely okay. 1. So the range, it starts from D3 all the way to D6. Point 5. 36. This is about 7 to 8 angle shift on the right side. Okay. This is going to feel a little bit warm. Just going to slowly press down along the spine and move towards the outside of the thoracic walls, looking for any abnormality in movement of the spine. So I'm going to press down, see if there is any swelling. We're looking for impaired circulation. It's a good sign. I'm not noticing any redness, at least not now, which means that there's good perfusion towards the spine, and that's exactly what we want. And as we're moving away from the spine, there seems to be a little bit more redness, which is expected, and we can work on this muscle to increase their circulation. Okay. You're gonna feel like a tapping sensation. I'm looking for neural pulsations, the abnormal movement around the muscles of the spine. Abnormal reflexes at C3. I'd like to see a little bit more movement there. I'm going to start with a sensory stimulation. It's going to feel like a brushing sensation. It helps to stimulate the nerve cells and to alert the muscles that we need to increase circulation. ahead and tell me when you don't feel the vibration anymore. Now. 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 Okay, that was good. Nerve movement. Okay, I'm going to start with spine adjustment. This is going to feel like a popping sensation. It's supposed to alleviate pain and increase spine mobility. This helps to shift the vertebrae into the right position. I would like to see a little bit more movement in this. This is going to feel like a sharp sensation. It's going to help to stimulate blood flow around the spine. We're going to start with skin pulling. It's going to help to increase circulation in the areas that we're trying to treat. Starting with the thoracic area. Okay, go and take a deep breath in and breathe out. Good. And the same thing on the other side. Take a deep breath in and breathe out. Okay, I'm going to apply an anti-inflammatory oil. Just slowly increasing pressure. So trying to target the intercostal muscles so that we decrease the incidence of spasms. Going to use cupping therapy to help stimulate blood flow. This brings a lot of toxins closer to the surface. Focusing on the right side. applying multiple pressure on the points that help to trigger the inflammatory markers. This helps to decrease inflammation. And this is the part that has most fluid behind the tissue. It also helps to dissolve the knots that have been forming in the trapezius muscle. This helps to dissolve the knots and to decrease tension. going to apply kinesiology tape. It's going to help to maintain homeostasis in the spine. Perfect. It looks really good. I think we were able to target the muscles in between the scapulas really good and to decrease inflammation in this area. I'm going to have you get dressed and we'll see you back in the next session.